All right, so this is a heat map. I've been showing these heat maps since early July, and it's gotten even more redder than prior. Last time we spoke, about 84% of the counties in the United States were at high transmission, and about 10% were substantial. And so we've had an increase in the number of counties in the high category. Let me get a laser pointer here, and let me get my notes up here too, if I could. Boy, I'm having a few technical difficulties here. I apologize. That's interesting. I don't know what that is. So, okay, I think we're hopefully back on track here. So, anyhow, so you know, the CDC moving case rate over the past 7 days. A couple of weeks ago, we saw that the increases were somewhere on the 33% change over the 7-day moving average. Last time we spoke, I think it was about 13%. Now it's 14%. So there's been a little bit of flattening in the nationwide case rate curve, but it's still going up very precipitously. Potentially, this is due to the heat, and also some people speculate it's likely due to more people getting vaccinated. And we've talked about the Delta variant, and last time we presented this, the Delta variant was about 82% of the strains out there in the community, and now nationwide it's 98% of all the cases. We're also seeing that vaccines are starting to tick up a little bit throughout the country. That's a very positive thing to see, because it helps us get through this difficult time. The biggest topic has been the hospitalizations. I'm trying to move this out of my way so I can see my slide. So nationwide, hospitalizations are going up dramatically, and that's been a big concern for us in our community. But it's not just Walla Walla, it's the country. Also, the CDC continues to show an increase in the death rate as well. And almost all of these deaths are in unvaccinated people. So if you look at Washington State is on fire. We knew things were starting to burn around us. I think we might have been one of the first counties to where the fire, I wouldn't say the fire started, but one of the major blazes started in Walla Walla, but it truly is the entire state. You know, we look at, this is the Washington State case rate, and this is lagging too, because I pulled this data on Saturday, but it's even worse than this. We're probably going to eclipse or pass the case rate that we had during the winter time. I like to look at King County a lot, and they may not reach their prior peak, but they're getting closer. Other western side counties, Pierce County, new peak. Thurston County, new peak. Cowlitz County has, you know, case rates that look like they're on the eastern side of the state. Same thing with Lewis County. So huge numbers all across the state. Our neighbors, Benton County, all-time highs. Franklin County reaching their prior peak. And Walla Walla, we continue on this slower trajectory, but our baseline case rate is still very, very high. I think we've probably, based on our internal numbers, we've surpassed 700 cases over 14 days over the prior 2 weeks. We've talked before that we are hoping that we're going to see a peak somewhere between now and, I was thinking August, but it may linger into September, but it's hard to know with that Delta variant. There are two sources where I get the rankings for cases. This one is off the Department of Health, and based on their data that they have, we rank 8th in the state for case rate. The governor's office, we rank 11th with regards to case rate. Back to the hospitalizations, this is the real story, and we've been talking about this for the past several weeks. We're in a difficult situation in the hospital system. Our hospital admissions are looking like they did back in January, but remember, we talked about how early spring and summer that the overall tide of hospitalizations were increasing for non-COVID conditions due to pent-up demand, delayed care, things like that. So we are at capacity, and then starting in June, we started seeing our increased cases, and due to staffing issues and increased COVID cases, it's basically unsustainable. What's changed, though, and I believe we talked about this last week, is everybody around us has the same problem now. So we've lost slack in the system. And if we get into a situation where we need to send people out, there are circumstances where we lose that opportunity and that option. So the key is to really keep COVID cases and hospitalizations down. This is the Washington State rate of hospitalizations per 100,000 people, and as you can see, it's at about what it was during the worst part of the pandemic during the winter. But again, we had that rising tide of non-COVID cases, and so it's putting a huge strain on our hospitals. As far as hospitalization case rate, and I didn't put this slide up to show that we're not the worst, but to put this slide up showing that our hospitalization rate statewide, and this only includes about 15 or so of the states, it's just huge, and it's really important to focus our attention on trying to keep people out of the hospital. We've also mentioned that the percent of the cases with severe illness, hospitalization, and deaths are almost always in the not fully vaccinated group. And there is a little glimmer, as you can see, a glimmer of hope. As you can see, these numbers are declining slightly. For instance, percent of hospitalizations is down about a percentage point from August 11 to August 18. And it's such a tiny window, it's hard to know what to make of it, but there's this overall trend that things are getting better, but that seems to be due to vaccinations as the vaccination rate starts to tick up. This graph is helpful to see that the green line down at the bottom, if you're fully vaccinated, your chance of going in the hospital and dying is significantly lower than the unvaccinated. The red line is the unvaccinated. And this line is reproducible among many different demographics. The bottom graph, I believe, is in those 65 and older, and the top graph is those between 45 and 65. So anyhow, we're just at an important time where we need to really come together, encourage each other to get vaccinated. The longer this drags out, our socioeconomic risks to our community goes up, and potentially could only get worse due to variants that may be more deadly or resistant to vaccine. So I'm going to end there and answer any questions.